Hello, and welcome back to the Gluten Free RN podcast. I'm Nadine Celiac, RN, BSN, CEN, certified emergency room nurse in a former life, and now known internationally and trademarked as the Gluten Free RN. Today, during episode 40, we're going to talk about multiple sclerosis, other neurological disorders, and celiac disease. Stay tuned. Hi, and welcome back to the Gluten Free RN podcast. I'm Nadine Celiac, the Gluten Free RN. Today, during episode 40, we're going to focus on MS, multiple sclerosis, and celiac disease. We're going to talk about several studies, which are referenced in the podcast notes, and I'm also going to give you some anecdotal stories, some of which are still developing. For those of you that read my book, Donation, A Nurse's Memoir of Celiac Disease, From Misdiagnosis to Food and Health Activism, I talked a little bit about MS, multiple sclerosis. Interestingly enough, in my long litany of symptoms that I actually had prior to getting sort of diagnosed with celiac disease, I was having my own episode and scare of MS. While I was walking the dogs or at the beach, I would have episodes of falling. Just out of nowhere. It wasn't like the leash got tangled around my legs or anything. I just found myself falling, especially when I turned around quickly or made a quick move. My kids actually also noticed that I was dragging my feet in the house. And one of the ways they recognized that I was dragging my feet is that I would leave little track marks on the hardwood floors of our house with my shoes. Like little skid marks, I guess, with my shoes because I was dragging my feet. This didn't happen all the time, but it happened frequently enough that, number one, my kids noticed, and number two, I was fairly concerned that I was developing symptoms of MS. I'd always been considered to be clumsy as a child, and I would drop things. Neurologically, I was already having neuropathy and a few other signs or symptoms that were concerning to me. Interestingly, once I went on a gluten-free, dairy-free diet, my symptoms of MS or falling or dragging my feet eventually disappeared. I've been on a paleo diet for the last 6 years and have been on a gluten-free, dairy-free, soy-free diet at least for the last now almost 11 years. It did take 2 to 3 years for my neurological symptoms to disappear completely, but I no longer have neuropathy, which is numbness or tingling in my hands and my feet or in funky patches on my body. I used to have a patch on the top of my right thigh that would get numb. It was really weird, but I did note it quite a bit. So my numbness and tingling went away. I no longer fall. I wouldn't consider myself to be particularly clumsy anymore, although occasionally I do drop things. So I'm much happier now that I do not have neurological symptoms that would be associated with celiac disease, even or non-celiac gluten sensitivity. The idea of having MS was not appealing to me. And at the time, I was 36 years old. So now that I'm more of a fully functioning, neurologically intact 51-year-old, I am not taking my neurological health for granted at all. About the same time I was researching celiac disease, I also came across a TED Talk by Dr. Terry Wahls, and that's Wahls, Wahls. Dr. Terry Wahls is a neurologist, and she herself had debilitating MS to the point where she was incapacitated in a wheelchair. Now, even from her wheelchair, she was motivated to do research on her condition, which was, again, completely debilitating MS. So she was not able to work, she was not able to ride her bike, she couldn't walk, and she was in this wheelchair, but she was still doing research. And what she found out was that there was a potential that she could change her health by changing her diet, which she did, by the way. I've had the opportunity to meet Dr. Wahls a few times, and every time I've met her, she's been progressively better. Initially, when I met her, she was still walking with a cane, and now she's walking independently without a cane, riding her bike, and she is currently giving seminars on how she healed herself. She's doing medical studies She's written a book called The Wahls Protocol. Again, that's Wahls. And I'm highly recommending that you research the TED Talk that Dr. Terry Wahls did. There's lots of good information in there on healing the mitochondria and healing the neurological damage that's been done. Dr. Terry Wahls is primarily on a paleo diet, her version of a paleo diet, which is very high in dark leafy greens and other nutrient-dense foods. The only caution I would give is if you have a problem with oxalates, that you investigate and find out if you should be on a diet that includes a lot of dark leafy greens. If you have calcium oxalate kidney stones, that would be a good indicator that potentially you need to be on a low oxalate diet. Sometimes that clears up once people are on some variation of a paleo diet or a gluten-free diet. If you ever get a chance to meet Dr. Wahls, she's incredible, and I feel very honored and privileged to have met her and had the opportunity to talk to her in person a few times. She is lovely. So for those of you that aren't aware, multiple sclerosis and celiac disease are both autoimmune issues. We know that celiac disease is triggered by the ingestion of gluten, and it causes villus atrophy, cryptic hyperplasia in the small intestines, and damage to the immune system. We also know that even though the damage starts in the immune system, it is primarily a neurological disorder. So, of course, the question has come up in many studies and for many researchers whether celiac disease and MS are similar or related or potentially the same thing, since there is a very well-researched condition called celiac cerebellar ataxia. Ataxia is when people can't walk straight. They have poor balance, they have poor proprioception, which means that it's hard for them to distinguish where their body is in space. So they might walk into walls, they might trip or stumble or fall, and this is directly related to the vision. So some of the multi-organ manifestations of celiac disease for the central nervous system include white matter lesions, inflammatory cerebral spinal fluid syndrome, sinus venous thrombosis, epilepsy or seizure disorders, cerebellar pontine atrophy, encephalopathy, myelopathy, dementia, gluten ataxia, headaches and migraines, depression, anxiety, and cerebellar ataxia. It can be also noted in the peripheral nervous system. MS is at the top of my brain right now because I'm working with a woman who's in her 60s, and she has a very profound diagnosis of MS, and nobody had ever tested her for celiac disease. So since I'm her advocate, when we went into the doctor's office, I highly suggested that she get tested for celiac disease both with an antibody panel and the celiac gene test, both of which were done. The antibody test was negative for celiac disease. However, my patient is a gene carrier for the celiac genes. And since she already has MS and several other associated signs and symptoms with celiac disease, the doctor did say if she doesn't have celiac disease now, she will in the future, based on her genetic makeup and the fact that she is accumulating autoimmune diseases. Interestingly enough, my patient had already gone on her variation of a gluten-free diet and started to get better. She is off at least one of her medications at this point, and over time, we're hoping that her medications will decrease, and that will be up to the physician. But once her symptoms start to improve, then there's every reason to believe that she'll be able to decrease or discontinue some of her medications that she's been on for years. The other thing to keep in mind, especially with people that are on medications that aren't working, is that if people have malabsorption issues with food, there's a good chance they're going to have them with medications also. So if a person has a hard time absorbing medications, meaning that they're not working well for them, then it needs to be investigated whether or not that malabsorption stems from undiagnosed celiac disease. So here's a case report, and I did read some of that initial information from celiac disease with cerebellar and peripheral nerve involvement mimicking multiple sclerosis. This study comes out of Vienna, Austria. And let me just read the abstract. Due to the similarity in the clinical presentation, morphology, and course, celiac disease may be mixed up with other immunological disorders such as multiple sclerosis, MS. Case report. In a 43-year-old Caucasian male with a history of diarrhea and colics since young age, progressive sensory disturbances developed since age 18 years. At age 34, he was diagnosed as relapsing remitting MS upon an inflammatory CSF syndrome and nonspecific white matter lesions and treated with interferon beta 1b during the next 8 years without effect. Interesting. At age 35, axonal polyneuropathy and ataxia were diagnosed. Despite normal anti-gliadin, endomyocele, and transglutaminase antibodies, celiac disease was diagnosed at age 41 based upon the history, polyneuropathy, positivity for HLA-DQ2 and HLA-DQ8, the white matter lesions, and beneficial response to the gastrointestinal problems and polyneuropathy to a gluten-free diet. Conclusions. Celiac disease may mimic MS and may be present despite the absence of anti-gliadin, endomyocele, or transglutaminase antibodies. CD should be considered if there is a gastrointestinal problem, polyneuropathy, and ataxia, even if CSF and MRI findings are suggestive of MS. There is new evidence about seronegativity in celiac disease, and seronegativity is interesting because we are only testing, for the most part, for most labs, for the tissue transglutaminase 2. It's the tissue transglutaminase 6 that is specific for the neurological damage that can occur with gluten. So if the lab that you're using isn't testing for the anti-tissue transglutaminase 6 along with the 2, then there's a good chance that that test will be negative. Again, I've included all of these studies that I'm going to reference and other ones in the podcast notes. So I'm going to suggest that you look at those, read them over, and reference them. And if you're so inclined, take those studies to your physician and suggest that you also get tested for celiac disease. Another great study comes out of Italy, and this one is from the International Journal of Neurology and Neurotherapy, Celiac Disease and Multiple Sclerosis, a controversial issue. And this is from the pediatric department. Again, it's referenced in the podcast notes. I'll just read one paragraph out of this particular study, and basically it says, the first description of some clinical improvement with gluten-free diet, additional vitamins and minerals in a small group of patients with MS dates back to 1974. So historically, this is not a new idea. Researchers have been looking at MS and celiac disease concurrently for a number of years. In 1996, different neurological manifestations have been reported in celiac disease patients. Since then, several authors have reported small case series of celiac disease in MS, and recently, even a more significant increased prevalence of celiac disease has been shown in MS first-degree relatives, up to 18%. So again, seems to be a significant genetic overlap with celiac disease and MS. Even to the point that the University of Chicago Celiac Disease Center answered the question, is MS or multiple sclerosis associated with celiac disease? Their answer on their website is both MS and celiac disease are autoimmune diseases and share the same genes. Approximately 10% of those who have MS also have celiac disease. Whoa, that's important to know. So again, if we know that every type 1 diabetic is a gene carrier for HLA-DQ2 and or DQ8, then according to the Celiac Disease Center at Chicago University, then every person that has MS is potentially a carrier of the HLA-DQ2 and or DQ8 genes. In my initial research, I cannot find any studies where every person with MS has had a genetic test for celiac disease or the HLA-DQ2 and or DQ8 gene. If you find that information, please send it to me. I love it when other people send information to me that is pertinent to anything to do with celiac disease, especially when we can help a vast majority of people all over the world with this information. And these tend to get reported as case studies in the literature. So I'm going to read another one. And this is from Advanced Biomedical Research. This particular study was done in 2013 in Iran. So all over the world, MS and celiac disease are being studied. These important questions are being hopefully asked, researched, and answered. I guess the reason I'm reading these case studies also is because people tend to see themselves in a lot of the information. If any of this information applies to you or your family members, it's good to know it because there is a lot of overlap, not just with MS, but with other neurological manifestations and celiac disease. So in this case report, it says, our patient is a 37-year-old woman with a history of chronic abdominal pain since 2004. And anti-gliadin antibodies of isotype IgA and IgA tissue transglutaminase antibody were present in the serum. So she had a positive antibody test for celiac disease. Gastric and duodenal biopsy documented chronic gastritis associated with Helicobacter pylori, so H. pylori, and chronic duodenitis, but not celiac disease-related pathological findings. Gluten-free diet was started and her GI symptoms subsided, so diagnosis of celiac disease was made. In her past, about 18 years ago, so it took this woman 18 years to potentially get diagnosed with celiac disease, her left eye became ophthalmoplegic, so she couldn't move her left eye, and without a definite diagnosis after corticosteroid therapy, it was recovered completely within 1 month. 5 years ago, she suffered from diplopia, which was binocular and continued until now. A few months before, she had become ataxic. Again, that means that she was having difficulty walking, maybe falling, walking like she was drunk. She thought that it had been related to her diet, although it evolved and established completely within a few days. So she met a neurologist and her brain MRI showed demyelinating plaques compatible with multiple sclerosis, without any structural abnormality in cerebellum. Her visual evoked potentials, VEP, were abnormal too. Delayed responses with normal wave configuration. Oligoclonal band was seen in CSF examination. Therefore, the clinical diagnosis of MS was made and Avonex was introduced to her. Till now, she has not had any relapse and her neurological disability is fixed. Now, she has had episodic ataxia and slurred speech, especially whenever she is tired. On neurological examination, she has binocular diplopia and fine horizontal nystagmus when she looks to the left side. Her plantar reflexes are upward. Abdominal reflexes are not detectable, and her deep tendon reflexes are symmetric and exaggerated. Her gait is ataxic, and she falls when turns rapidly. Other neurological examinations are not remarkable. So they conclude that the concomitant presence of MS in an atypical clinical course and CD, celiac disease, likely shows an unusual chance association in our patients, but immune-mediated damage to the CNS triggered by gluten could not be excluded. What I would say to that is this is probably a patient that got better on a gluten-free diet and then got re-exposed to gluten or was using a product that she did not know had gluten in it. There are many cases of people that have neurological symptoms that come up when they get exposed to gluten. Some people will get headaches. I had one gentleman who was a pastor at a church. One of the ladies in the congregation actually made him cookies that she assured him were gluten-free. So before service that day, he ate a couple of her cookies. And right before he was supposed to start the service for that day, he suddenly developed shaking and tremors, couldn't talk. His congregation thought he had a stroke. I got a call from several of them, and they were very concerned that he was having some type of acute neurological event. So they called me, they called the ambulance, he went in, and come to find out those cookies were in fact not gluten-free. So gluten is a neurotoxin, and it doesn't take long for that neurotoxin to actually affect our nervous system. So I would suggest that that patient in that study was still getting doses of gluten, perhaps on a regular basis. And until that can be confirmed or denied, I think that it would behoove that patient to reevaluate her diet or have her nutritionist or nurse or someone who's her advocate really look at her diet and make sure that she's not getting any dosage of gluten, even a breadcrumb can trigger the same autoimmune response. So even a cross-contamination issue could be the cause of her continued or worsening neurological symptoms. Of course, there always is the chance that the MS is the primary cause of that, but it always needs to be investigated whether there is continued contamination or cross-contamination with gluten, especially in a person that has known celiac disease. Another study was in the Nature Reviews Neurology in 2007, and this is a case of celiac disease mimicking ALS, amyotrophic lateral sclerosis. The case study reads, a 44-year-old male presented to a general neurology clinic with a 6-month history of progressive right-sided spastic hemiparesis without sensory symptoms or signs. The thigh muscle in the affected leg showed signs of wasting. So this is muscle wasting. The patient had a remote family history of celiac disease. The investigations included a neurological exam, neurophysiological studies, brain MRI scan, routine blood test, duodenal biopsy, cerebrospinal fluid analysis, including polymerase chain reaction test for JC virus DNA, serological testing for HIV, and for the presence of serum antibodies to endomycin, gliadin, and tissue transglutaminase. Diagnosis celiac disease with neurological involvement mimicking ALS. So again, I can't emphasize enough that anybody that has neurological symptoms be tested for celiac disease first and foremost, and then also tested with an AGA, which is an anti-gliadin antibody, which is an excellent biomarker, if not for celiac disease, then for non-celiac gluten sensitivity. But if a person is HLA DQ2 and or DQ8 positive and their blood tests are negative, but they're still developing all of these symptoms that either don't make any sense or there's no other option other than pretty significant medications, then the patient should always be given the option of at least trying a gluten-free, dairy-free, or hopefully just a whole food and or paleo diet, which also translates into a low carbohydrate, super good high fat diet as an option. Food is medicine and we need to use it as such. There's also a great article about the prevalence of celiac disease in multiple sclerosis, and this was in BMC Neurology from 2011, so you can reference it in the podcast notes. I'll just read the conclusion from this one. We have found an increased prevalence of celiac disease in 8 of the 72 MS patients, which translates into a prevalence of 11.1%, much higher than the 1% of the general population, and also in their first-degree relatives. This is important, 23 out of 126, which is 32%. Therefore, increased efforts aimed at the early detection and dietary treatment of celiac disease among antibody-positive MS patients are advisable. So, multiple sclerosis is a chronic disease of unknown etiology, but it is considered to be a T-cell-mediated antibody response, very similar to celiac disease, which leads to a demyelination of the central nervous system, or the CNS, and associated with autoimmunity, which means your body is attacking itself. It's never a good idea. Keep in mind that you also have an enteric nervous system. So if your enteric nervous system is damaged, sometimes that leads to constipation or diarrhea, constipation being a paralysis for some people of their enteric nervous system, which will prevent peristalsis from occurring. Peristalsis is the movement of the smooth muscle in the small intestines that help us push all of the food that we've eaten and that turns into stool out of our body. So peristalsis is a very rhythmic motion, but if that gets paralyzed, some people actually, it leads to constipation. That can be an indicator that a person has damage to their enteric nervous system from gluten. So it's very important that we recognize that. If you're interested in doing any research, and I encourage you to do that on your own, please don't accept everything I say as absolute truth, but I am pulling a lot of this information directly from many research articles from around the world. I want you to do your own research, and I want you to look at all these research articles with a critical eye. And if you have any questions, find people that actually can help you. But if you are looking for research articles on the neurological component of celiac disease, I encourage you to look up the name Dr. Marios Hadjivasiliou. I'm going to spell that for you. It's Had as in dog, JAV as in Victor, ISSILIOU, Hadjivasiliou. He is the celiac disease expert in the world in respect to neurological disorders and non-celiac gluten sensitivity. So if you're doing research, please look him up and check out his research articles. I find them very valuable and quite informative, not just on MS, but a number of neurological disorders. And as a nurse, I very much want to make sure that people have this information because also as a nurse, I see people that are in lines in recliner chairs hooked up to IV machines, getting chemotherapy medications and whatever medications they're getting for their MS that may or may not help. And if they have celiac disease, and celiac disease is the underlying issue, if they adopt a gluten-free diet or some variation of a whole food diet or follow Dr. Wahls' protocol, there's a good chance they could get better. Neurological damage takes a lot longer to heal than the intestinal damage in the absence of gluten. So the villus atrophy will regenerate and heal within 6 months to a year on a strict 100% gluten-free diet. The neurological symptoms take longer to heal, sometimes 2, 3, 4 years to heal. But your neurological system wants to heal. We have what's called neuroplasticity. If we remove the neurotoxin, which in this case could be the gluten, we are giving our bodies the best chance to heal and potentially regenerate. And everyone should have that option. Everyone should have access to this information. I will remind everyone at some point there is damage done, and it's really hard to undo that damage if at all possible. Sometimes the damage is done and we just can't fix it. It sometimes is difficult to heal the neurological symptoms, but if we can heal the intestines, replete with the missing nutrients, especially the B vitamins, the zinc, trace amounts of copper, magnesium, the very important nutrients that are missing in these people with celiac disease, perhaps their neurological symptoms will improve just from having their deficiencies repleted. And as a nurse, I really am encouraging people just to get the celiac antibody test to find out your HLA-DQ2 and or DQ8 status. Any doctor can order that. Any primary care provider, nurse practitioner, naturopath, anyone can order these tests. And if they have a hard time interpreting what those tests mean or there's any questions, I'm happy to do a consultation with you or your family so that we can make sure that everybody has the right information. You can also read my book, Donation, A Nurse's Memoir of Celiac Disease from Missed Diagnosis to Food and Health Activism. You can listen to more podcasts, both from myself and other practitioners. There's lots of information out there. Read Dr. Terry Wahls' book, The Wahls Protocol, and look up research articles from Dr. Hadjivasiliou. I was not willing to accept the fact that I had potentially MS and many other autoimmune diseases. Believe it or not, I don't have any autoimmune diseases anymore. I don't suffer from symptoms of MS. My Graves' disease is gone. My ANA panel, which had originally been positive, is now negative, which is an indicator for autoimmune diseases. So if this podcast gives you nothing else, I hope it gives you good information and hope. Hope that potentially you can get better or that your family members will get better. There's no downside to a gluten-free diet. There's no downside to a whole food diet, provided you are working with an educated practitioner or a nutritionist or a nurse, someone that actually understands what functional medicine, integrative medicine, how to deal with the underlying causes of illness, signs and symptoms, and disease. Thank you very much for joining me for this episode of the Gluten Free RN podcast. This has been episode 40, believe it or not. And MS, or multiple sclerosis, is a topic that I'm very, very interested in. and hope that you've also taken out of this podcast more information so that you can do more research and hopefully get better. That is the goal. That is always the hope. Thanks again for joining me, Nadine Gruskowiak, on the Gluten Free RN podcast. Until next time, do your research, think critically, and if you think celiac disease doesn't affect you, your family, and your friends, think again. Until next episode, use food as medicine and work really hard to heal your body and your neurological system. Thanks again. Bye.